So I think we can go ahead and get started. I'd like to welcome you all to the session today. I hope everyone's been having a wonderful time over the last 2 days at this fantastic conference. My name is Hasina Samji. I use she, her pronouns, and really grateful to be calling in from the Unceded Traditional Territories of the Coast Salish peoples out here in Vancouver, British Columbia. I'm an associate professor in the Faculty of Health Sciences at Simon Fraser University. I have a joint appointment at our BC Centre for Disease Control as a senior scientist in population mental well-being, which is absolutely a title I made up myself, and focuses really on population level mental well-being. I'm delighted to be here and we have an excellent panel planned this afternoon. As mentioned, we will be thinking about digital landscapes, and we have three amazing speakers who are going to provide some incredible insights in this topic in an informal way. So I'd like to share, before I introduce our speakers, I'd like to share just the broad outline for the session today. So after I introduce the panelists, and we'll look to Eric to provide their full bios, which are very extensive because they're very impressive folks. After that, we will start by asking a few kind of key questions. And thanks, Eric, for posting those. That have been kind of brainstormed ahead of time. And any panel members that are interested in responding to the questions, just raise your hand and I'll know. And then you can lower your hand, and then anyone who wants to answer any question will have the opportunity to do so. And if there's time at the end, I'd also love to take some questions from the audience. So as folks are speaking, or if you came with a question, a burning question already in your mind, please feel free to post it in the chat at any point, and we'll do our best to get to some audience questions at the end. At the very end of the session, we'll give each panelist sort of a 1-minute wrap-up opportunity to just state their kind of final thoughts, and then we'll return back to the overall session. Okay, so without further ado, I'd like to introduce Dr. Nicole Letourneau. She is a professor and assistant dean in the Faculty of Nursing and Cumming School of Medicine, University of Calgary, where she holds the Research Excellence Chair in Parent and Child Health. She is a scientific director of the Alliance Against Violence and Adversity Health Research Training Platform and Women's and Girls Health Hub. She leads the Child Studies program. She created the Attach Parenting program and leads the Apron cohort study, among many other impressive feats. Our next speaker is Dr. Tricia Lingley-Potty. She has more than 35 years of pediatric nursing experience and is co-founder of the Strongest Families Institute, or CFI, and CFI's proprietary digital health platform called Iris. She is the president and CEO of SFI, an assistant professor in the Department of Psychiatry at Dalhousie University, and a scientist at the IWK Health Center. Last but certainly not least is Dr. Leslie Bruce, who is a clinical psychologist and associate professor at the University of Manitoba with appointments in psychology and pediatrics. She is a research scientist at the Children's Hospital Research Institute of Manitoba and has co-developed the BEAM program, which is an evidence-based e-health program that promotes parent and child mental health. Dr. Bruce completed her clinical residency at the Centre for Addiction and Mental Health in Toronto. All right, so welcome to all of our panelists and all of our participants as well. I'd like to get us started with an opening roundtable question. So our first question is, can you briefly describe your experience in adapting mental health promoting interventions to digital platforms? Anyone who would like to answer, perhaps all of you for this first opening roundtable. Sure, Trish, over to you.
I'll go first.
Yeah.
So we've been in the field, we're considered pioneers in the e-mental health solutions that have been co-designed with people for people. So with a pediatric and family focused lens in everything we do, all phases of research and evaluation, even from the point of translating from research into service delivery, we continue to do co-design and improve our programs to make sure they're tailored to meet people's needs. So with this, we've run clinical trials. So we have more than 25 years of social science backing. It was no feat at all. It certainly took time and patience and effort, but we also developed our own technology. And that's probably a whole other conversation about the challenges and the lessons learned. But Iris is a very sophisticated system. It's a 5.0 version. It has a user interface that is not just a bunch of PDFs, it's very interactive. So again, it was co-designed with people for people of all diverse backgrounds. And I think that's a real key as we're entering into this highly digital age where we've got a lot of commercial entities competing in this field. So the focus has always been family centered and making sure that we include as many caregivers that are in the home as possible and tailoring our program to meet their needs.
Thank you.
I'm happy to hop in next.
Yep.
Hi, everyone. Thanks so much for coming. So my experience in transitioning into digital mental health programs really started during the pandemic when we were in the midst of a number of in-person clinical trials for dialectical behavior therapy oriented interventions, and we really didn't know what to do in terms of how to provide the same sort of support we were providing for in-person groups, providing family meals, all those really wonderful things that we do to connect with families and provide a supportive environment. And I really echo Trisha's suggestion in terms of the co-design work, the importance of that. And I think in moving into the digital space, a good amount of humility in understanding really how new this space is to be working in. We have, many decades of work in family mental health programming, but we don't have the same evidence base for online programs. And although starting with what we know works best and translating that into online spaces, I think is the really important place to start. I also think that there's such a tremendous amount to learn. And so we're continuing to learn with families that we work with as we do adaptations, trying to figure out how do we adapt this for new implementation contexts, new cultural contexts, different age groups. And so I think that has been really exciting for us, as just knowing that there's so much to learn in this space and the opportunity to learn together with a community that's also always changing their relationship with online tools, how much they want to interact over Zoom or on a phone. We've seen big transitions there. In the pandemic, everyone wanted to be on Zoom. Now it's not as popular. So trying to figure out how do we connect with people in different ways that are still going to be supporting mental health effectively.
Yeah, I guess that leaves me to round out the round. Um, Much like Leslie, we really started the transition during the pandemic because all of our interventions initially were designed to be delivered in person, and we couldn't. And you know, we were getting a lot of clamoring of desire to keep receiving the program, so we had to figure something out. We initially started to use Zoom, and it was working pretty well because it met needs in the short term. And then we got some funding from CIHR to develop an app for two of our interventions attached. You heard about another one, VidKids. And we did develop the app and we did user design and all the things that we were supposed to do. But we ended up, and I would love to talk more about this because it really posed a ton of challenges developing the app. We spent over $100,000, like $140,000 on it, and ended up not using it because that you needed to have a different technology for every device that people were accessing the app on, and it actually made our intervention ineffective. So with that, we made a really tough decision actually to just leave that funding behind and consider it hard learning, and went back to Zoom because people can access Zoom everywhere. And I suppose that will be what we continue to use, and until maybe there's a different platform that's as easy to use. But we persist now in delivering our interventions with Zoom or in person, now post-COVID. And it's been terrific because we have built in increased accessibility for parents who want to access our program, and for service providers that want to deliver it. It just makes it so much easier for everyone. Service providers don't have to go out to the homes. Clients don't have to come into the clinic. If they want to, they can. Absolutely. But our initial findings are even showing there's no difference between the effectiveness of the program delivered online or in person. So we're pretty happy about that and excited to publish some of the look. We have published some of those findings. So anyway, that's been our journey. One that was expensive. And I'd love to hear how Trish and your team managed to make that work, because we were quite disappointed that we just couldn't make it work. It wasn't just wasn't going to be meet our needs or the needs of the families we work with. We're highly vulnerable, and any additional impediment to them accessing the program was one like just a step too far. So that's how it worked out for us.
Thanks, Nicole. And Trish, yes, please feel free. I see
Yeah,
you nodding.
I can completely relate to that, Nicole. And we've certainly encountered our own experiences, and one very similar to yours. But, thinking about the fact that millions of dollars of public funding was
Mhm.
invested in the Strongest Families system of care
Yeah.
back in the year 2000. Um, and yet, I think one of the lessons that we've learned is that is all fine and dandy and great. And we develop technology, we co-design these cognitive behavioral programs. We're very innovative. We're measurement-based care, high impacts, low cost, but yet the sustainability of funding to continue the work in the digital space is not there. As a nonprofit, we can't apply for the same type of technology funding that other for-profit companies or commercialized companies can. And I'm telling you, I've tried this fundraising. It's not sexy to try to raise funds to support the technology and the innovation. So it's definitely a challenge. And I'll tell you the way that we got around, I've gone bringing programmers in-house, and I've also tried outsourcing. But what we found the most effective for us, because you know how iterative this process can be, having our own internal team is what we decided to go with. And you really need to understand when you're venturing into this, where are you going to go with it? Strongest Families has 21 iterations of all of our programs combined because we're fully bilingual. We have, thanks to Public Health Agency Canada with this MHPIF grant that we have, we've been able to take our very, very highly intensive programs and map them onto a step care approach. So you can see that there's a lot of iterations. So we couldn't be in the position that were in, where we had an app for this, an app for that. That would have been atrocious. So we actually had to raise funds to go back to the architecture of Iris and develop a fully interoperable app. So that's how we got around it, but it wasn't without a high cost. I will give you an example. Dr. Mandy Newton from Alberta, I think it was UFA, took one of our anxiety programs to create a self-mediated program, and it was available on multiple devices. But we inherited it after she completed her randomized trials, and we don't have enough funding to upgrade it because it's not interactive or interoperable with our Iris system. So I can relate to that, and it's really a huge challenge. Here we are 25 years later, and we struggle to get funding just to maintain her Iris and the security of it. $25,000 a year is our security audit fees, plus cybersecurity, let alone just trying to innovate her to move her forward with all of our wish list items. It's very difficult.
Yeah, and can I add on to that too before you go to the next question, Sina? But that was one of our decisions as well, because we worked with a developer, and it was they were not as responsive as they needed to be. Like, if a participant or a client had a challenge with the platform, they couldn't get help quickly enough. And then we were going to be needing to pay for that service forever. You need to pay $30,000-$40,000 a year forever once they've developed your app, and and it just seemed to be that every single thing we wanted to do was costing more than we expected. So in the end, we went with ease. Everyone can use Zoom. Everybody at the time, was using Zoom, and we just went with ease, and it's continued to work for us. But I do wonder how teams who are trying to develop apps are imagining continuing on with them, because unless you have a for-profit model, which we
Right,
tend not to do in our space,
right.
we're working with vulnerable families and so on. They don't have money to be paying for this
No.
stuff, and it's even hard to defend, let alone fundraise. So I'm really curious about how people are like you are making this work. So there's many challenges.
Yeah, absolutely. And I'd be happy to even take it offline, Nicole, further talk about it.
I think this conversation is already surfacing some of the key challenges in the digital landscape, and probably really helpful for participants who may be at different points in their journey about trying to adopt digital technologies. Our next question surfaces the equity pieces, Nicole, that you were starting to reference. So, I mean, broadly, why do you think digital solutions are important for mental health promotion? But what role does health equity play in providing digital options for intervention as well? Who'd like to start us off?
Maybe I'll
Nicole?
just say something quick and then I'll pass it to Leslie. But absolutely, for us, it's been all about equity and accessibility and making sure that people in rural and remote communities, as long as there's an internet connection, they can access services that you can get in the big cities. So for us, it's been a real equalizer and been something that's been very attractive to all the community agencies that we work with and the families that we're trying to serve. So number one, and I'll just leave it at that.
Yeah, it's such an important question. I really echo Nicole's comment about rural and remote communities. I know previously in person, we did not have anyone from rural areas who was really participating. And we now in our implementation trials have about 35 to 40% of people who are outside of central urban areas. So that's one element where I think we have an opportunity to connect with people. And at the same time, there are challenges with bandwidth differences, even for people who do have things like smartphones. So we've had to work with our developer, whose Mindsea out in Halifax. Trish, interesting to hear about different processes, to make sure that we have an app that works on different types of devices, not only the latest iPhone, but also Android and older versions. So we do a lot of user testing to make sure that there's flexibility for bandwidth. And we're working to continue that as well, to even have options where you can download content from an app that then is updated when you're online, but everything's still functional in different contexts. Other elements of inclusivity and equity is, with that larger reach, being able to understand who is joining your interventions. I think there's a potential to have a much wider reach than you might otherwise. So we see sociodemographics, for example, in Manitoba that are reflective of the population in Manitoba. So lots of diversity there in terms of income, in terms of race, ethnicity, cultural groups, of people signing up. And at the same time, we know that that doesn't mean that the app works equally well for everyone who signs up. So I think it's really important to take issues of equity, carefully and collaboratively and in co-development with the communities in which you're working. So for BEAM, which is a family mental health program for parents of young children, we're also now doing a number of adaptations, and all of those are led or co-led by members of the communities that it's intended to serve. So that is really, really interesting, and has also highlighted the potential for I think really thinking creatively about technology. It's not technology or in person. It can be technology and in person. So in thinking maybe there's a community center where you can connect, come and do cultural activities, talk with, elders or knowledge keepers about things that are important. And you might be working with a coach who can send you messages over an app, or you can connect and see videos a different way. So really thinking about these questions of inclusivity from a really wide lens and being flexible with what you're thinking that your intervention and evidence base is, and making sure that you're continuing to update it as you get new information. There's a lot of potential, but you really have to be motivated to be making sure that your program is providing supports to who you hope it provides support for. Otherwise, I think it's easy to put something out there that has, evidence in 1 or 2 trials and that you don't really continue to understand how it works and how we can improve it.
Absolutely agree. We have to be very intentional. And, you're going to hear me constantly say co-design is where it's at through all phases. And that iterative process is really important. We are so data driven. We're using not just holding our advisory committees with families and youth and children, but we also use our satisfaction data to make sure that we're keeping that updated. I think I'm going to add to the conversation by saying, again, this measurement-based care, we need to look at our data. We need to understand the representation from the communities that we're serving. And that's what we do. It takes time to build trust. I mean, I deal with a lot of remote indigenous communities. And at this time of virtual fatigue, when people are really preferring face-to-face services and not as much virtual services, I think it's really important for us to be looking at our data, seeing what more outreach that we need to do. So we're spending more time and energy on outreach to community organizations and paying for promotional activities than we've ever had to do in the past. Um, and when you go back to the co-design piece, that's part of that building the trust in the brand. I fly into remote communities to meet with people. You know, they always say, Trish, you have to have 100 cups of tea with us before we trust your brand and that type of thing, even though we have all of the data in the world to suggest that we have cross-sectional impacts. But again, like for me, it's all about who are we reaching? And then we look at our outcome. Are we having different outcomes in different populations? Are there some that are not benefiting as much from our programs? So we are telephone coach based, and some of our high intensity solutions have 1 hour meetings, so up to 17 hours of coach led intervention. But we do have level 1 population mental health approach and prevention, where it's a very brief program. But what we have found in our research is if it's just purely self-help, there's not a whole lot of motivation to do much. And if people only register and they don't actually do any of the sessions and learning the skills, we're not going to impact outcome. So we do look at those type of factors too. And I think that's important as our responsibility to make sure that we understand who's accessing our services, how far are they getting, and what are the impacts that we're having, and what can we do differently to improve, to increase adherence and whatnot. I love the fact that, Leslie, you're mentioning about your app works without a wireless connection. That's what we had to spend extra funding on, was to make sure this was fully interoperable, one app for all of our programs. We actually have contracts with other folks who put their program on Iris, because we do have this fully interoperable app. It's easy to do. But with that, we bridge that digital divide. We make this more equitable for people in those hard to reach places, or who are financially disadvantaged and can't afford the high speed internet, or it doesn't work. We know that can happen. And our app too works offline. They can still get all the tips and reminders about their skills and the content as well. And I think that's a really critical part of a design of a digital solution. And you know, just building that trust with the communities is a lot. It's a lot of effort, but if people can see ourselves in these designs, it's more relatable, and again, it will build trust.
Thanks, Trish. Some important points about co-design and equity considerations as well. You've also started touching on the importance of measurement and evaluation. So why don't we continue the conversation there? So what needs to be in place to design, implement, and evaluate initiatives that are available online or through mobile apps? Who needs to be engaged as part of this work? And I think even more broadly, why is evaluation important? So maybe I can turn to Nicole and then Leslie.
Nicole, you're muted.
Thank you. For me, the question is, well, why wouldn't you do that? I don't know what point I'll stop evaluating. I don't think I'll ever stop evaluating. So, and maybe it'll be more intense in earlier phases here still, although we're kind of like mid-mature, I guess, in terms of the programs we've been developing. But we, as we implement them with new organizations, as we adapt them to different languages, because Attach now is in Danish and Denmark, Portuguese in Brazil, and French in France, and as we adapt them, each time we check in, we do qualitative interviews with the stakeholders at various levels, the parents who get the program, the service providers who deliver the program, and the agency leaders who advocate, I suppose, or champion the programs being delivered in their organization. Because so far our programs have been delivered by our partners' organizations, not by us directly. So we use implementation science methodologies. We use something called the normalization process theory to develop interview guides. And really what we're trying to do is figure out how to make what we do with the attached program or the VidKids program, but more the attached program, how to make it normal part of practice in the organizations. And so we're always, these interviews enable us to identify barriers and things that we can try to overcome, facilitators, challenges. As you know, and that goes right alongside the effectiveness, like the quantitative measurement and that sort of thing. So that's what we've been doing. And I don't know when I will stop. I haven't contemplated that yet, so maybe I'll bounce it over to you now, Leslie.
Yeah, absolutely. I think there's so much money that can be invested in digital health infrastructure solutions programs. It's sort of an ethical responsibility to continue with measurement-based care and evaluation. I think that that's really true across, I would argue, probably all aspects of the health sector, that we make sure that we're putting money and resources where they're making a difference. So that's really important. I do think that, thinking about the burden of the types of assessments that we're asking families to do, thinking about where we get drop off in clinical trials is no small thing. And so I think being able to narrow down it over time to think, what's really critical information for us to get, and then what can we tell perhaps from some other clinical trials that we sort of assume is probably in place or is going to change if these core measures are changing, is really relevant to consider. I also think that empowering, data to be something that individuals and communities can use and benefit from is really important. We've sort of tried to bring in rapid cycle learning in terms of offering feedback back to the community and back to people who are referring clients to us about, how's this program going? What are the results that we're seeing? How are people benefiting? What are, the different types of emotional challenges that families are having, is a really effective way to sort of really collaborate with folks and have people, more excited and engaged and knowledge partners in this work. And similarly, thinking about that for clients, symptom tracking is an evidence-based approach to a lot of different therapies that we bring in, and we want to make sure that clients have that access to that data as well, that they're checking in on it with their coaches. And so I think there's a lot of interesting ways to think about how we collect and share data. I would also say that in the app-based space, there's all sorts of really, really cool data that you can get about how people are engaging. And it's also totally overwhelming to think about how are we making sense from all this information coming in. Tech companies have many, many teams of very well-paid, highly educated programmers analyzing this in really creative, interesting ways. And so I think figuring out, what are our steps to start to make sense of this in a more creative way, in a user-driven way, is important for us to understand. How do people engage? Why do they engage? Are there different profiles of engagement? It's an area that I'm really excited to get into. We haven't gotten into it too much, but I think when we think about data acquisition and digital health, just coming to terms with like how much data there is and what we want to do with it and when is a key question.
Great. I'll just build on that by first of all saying, Nicole, don't ever stop evaluating. It's so critically important. And I think it's our, due diligence and our responsibility to make sure, we can supply to our investors, be it government or funders, what's actually working and what's not, and for whom. That's where, being scientifically based and scientifically sound, measurement-based care, being able to use, look at the data in different types of scenarios. We also use a mixed methodology, so qualitative and quantitative data. We use our data every single day to inform decisions, to inform improvements. And I think it's really important from a return on investment. And this is my call to action. I've been on the Hill lately, just really promoting the good work that us academics are doing and nonprofits are doing. And nonprofits are suffering in the landscape today with the competitions. And I think it's just really important for us to be, standing tall and proud and toting our data, our evidence, our client stories about those impacts, and showing what the return on investment can be, but now, but into the future, because these types of solutions are durable. I'm going to just go back to what Leslie was saying about how we're using our data. And, we used when we co-designed, we have a publication on this, by the way, integrated knowledge translation strategy, right from the beginning of time. So I always talk about the end user, and that is like the most important piece to get it right by design. But also we include multiple different key interest groups, policymakers, decision makers, clinicians, just to make sure that this system that we built would actually fit within the current system and complement it. Iris is beautiful. She, as I said before, very interactive, but also sharing the data back to our clients is critically important for us. And so we have a point and click letter that really pulls in all the key intervention outcome pointers and the skills that work best for that client. And it gets consolidated into a 2-page letter that is accessible to our clients through Iris. So those are some of the types of evaluation processes we use, but also how we can make sure that our users of our system understand the impacts that it's had on them, and we make recommendations for further support if they need something beyond our program.
Thank you. A few of you have touched on the relational elements of digital platforms and interventions. And I wonder if you can speak a little bit more to this area in data that we've collected provincially in BC among young people. Most prefer to receive mental health supports in person, at least for a first point of connection. So can you speak a little bit to how the relational element is brought to digital interventions and, how, are hybrid approaches feasible?
Maybe I'll go first again. Well, our intervention is just like this. It's totally interactional and relational. We don't have any offline materials. The intervention happens in the 10 sessions, just exactly like this. Or you can do it in person. You could do half in person. You can do half online. It's just totally flexible, whatever suits you. So we haven't had any challenges to my knowledge, really. It's been remarkably positive. The Zoom platform for us in delivering our program. So I don't know what more to say about it. It's just that we haven't had people say, oh, they don't want to go online at all. We have not had that experience. In fact, we've had quite the opposite. They prefer to access the program and the facilitator just like this because it's so much easier. When you have young children, you don't have to leave your home. You might be a depressed parent, which is often the kind of families we're serving or affected by violence, and just the challenges are so great that we've just removed one challenge, having to get bundled children up, find a place for them to be, all that sort of stuff. And even though in the in-person environment, when people can deliver, receive the intervention that way, we provide childcare, they still prefer often to do it via Zoom. So we have not experienced challenges building the rapport and the relationship, which maybe is surprising, but for our population, that's how it's been.
Happy to jump in as well. Trish, do you want to go first?
No, you go ahead, Leslie.
Okay. Yeah, I think, hybrid is really interesting. I think ideally having, programming be up to the preferences of the family is really valuable. What Nicole mentioned, you can come in person, you can do hybrid, lots of choices. So I think that we know that that's a really good practice in mental health programming. I also think that there's just contexts where you can sort of do both. So for our program, it is, predominantly online and connecting with a coach, connecting with other families, accessing content. But we also have a systems navigator role of someone who they can meet with online over Zoom or who can come with them to support, conversations about housing, conversations with child and family services, bring them into their local community organization, which is a trusted, well-established for over 80 years organization in Manitoba, to learn about other programs if that's something that we think would be supportive. And so I think the real benefits of online content for us have been, accessibility and the ability to return to content. And so I've run a number of programs, online and in groups, and I really love that format. And I know the scheduling is often really tricky for people, even when you offer multiple times. And so the, choose your own adventure, access to content at any time is something that I really do value. And at the same time, for other people, groups are great. And when you make time for a group and prioritize it, maybe you're also making a little bit more time for your own investment in whatever you're doing. There's no clear answers here, but I think there are a lot of opportunities for hybrid, and you have the opportunity to reach a lot more people.
So in our experience, and again, this is tracking over time, our research has shown that our telephone coaching and no video develops very strong therapeutic alliance. And it's interesting, when I did my dissertation work, it was highly related to the fact that of the visual anonymity provided that protection, non-judgment protection. Um, you know, they were no longer inhibited. So their self-disclosure was not just higher, but more honest. And so we've just continued on with that because we have such high impact, high engagement. People love their coaches. They say they're like a friend to them. So we stuck with that. But I have to say, since COVID, there has been more people who are asking if they can go on video, and it's usually the kids. And we do allow, we do that on the occasion, and we're looking at providing that as a preferred model if they want it. A client, requests it. I agree with Leslie in the fact that, these types of virtual approaches, whether it's online, distance led, really does increase accessibility. And we take that very seriously on our end. We are here to work at times convenient to our families so that they don't have to take time off work. The children don't have to miss school. Or if a parent is busy wanting to do one of our parenting programs, they can do it at night when the children are in bed. So really, really making sure that we focus on them and what works best for them. And maybe there's more flexibility. Somebody who does shift work, then we assign them to a coach that has that flexibility in their caseload. We have a no wait policy, so we can reduce wait lists extremely rapidly where they exist, and we've done that in several jurisdictions across Canada. We also do provide, though, hard copy materials. So all of our skill-based materials have been designed in handbooks. So if they want handbooks, we provide handbooks and skill demonstration videos in different formats, but they can also have both. If they want a hybrid model from our perspective with handbooks and videos as well as their app connection, they can have both.
Yeah, I'm hearing across all three panelists just this idea of flexibility, and there's no one size fits all solution. Different folks and different families and populations will have different preferences. So great to hear that you have been able to accommodate all of those preferences. Our next question, I think, echoes one of the questions in the chat that Jonathan has posted. How have you seen digital solutions positively impact the mental health of children, youth, and their caregivers?
Maybe I'll begin again. Well, Attach has been extremely effective. And Attach is not designed for families affected by mental health issues only. It's designed for complex families that show up in typical community agencies that serve vulnerable families, like low-income inner city serving organizations where they are working with families that don't have housing, for example, or agencies where parents are getting services because they're having challenges with their children's behavior, or domestic violence shelter. So it's a whole range, right? And it was designed, actually, going back to your point, Trish, co-design went into actual development of the intervention before we even turned it into an online version of the program. But it was really about meeting the needs of families and not being too targeted, and appreciating the complexity that families bring to the agencies that serve them. It was designed so that it would be something that would be appropriate to the kind of clients that the agencies are working with served. So anyway, but bearing that in mind, so we have found, of course, we look at infant and child mental health as our key outcomes, particularly for Attach, and we've seen it. This is what's so exciting about it and why it's gone into other countries so quickly and so on. And we use rapid cycle design approaches too, Trish, that you did mention earlier. In our early work, we worked with the Harvard Center for the Developing Child who guided us in some of those approaches. But we have seen that it improves children's attachment security, which we know is protective for lifelong health and well-being, and particularly mental health. We've seen it improves children's behavior and mental health. So their anxiety decreases, their aggression decreases, their hyperactivity decreases, their overall internalizing behaviors sort of improve. And we see improved parent-child relationship quality. And all those findings are published. We have new findings on the new replication studies showing that mothers' depression is improved as well. And bearing, as we get more and more numbers of people that go through the program, we're starting to see these other findings that I think we couldn't see with the smaller samples as we were getting going. Because bear in mind, this is not a depressed sample per se. This is just families facing challenges. So we've been pretty happy about that. And then my other program, the Vid Kids program, quite similar. We're seeing impacts on the relationship quality, the parent-infant relationship quality, which if well, here we are. This is the related to the Mighty projects, and infant mental health is parent-child mental health, really. So we've seen improvements in parent-child mental health because of the exposure to the Vid Kids program, which is quite similar to Attach, but again, focus ones with depression and parent-child interactive behaviors a little differently. I'd love to tell you more about my project, the programs and what they focus on, but long story short is they both, I texted Jonathan in the chat these answers as well, but now I'm sharing them with everyone. So.
Leslie, did you want to go?
Go ahead.
Similar, like we're seeing the similar type of outcomes that Nicole has mentioned. And again, we have quite a few publications, but we also dig a little deeper too. And, we're not focused just on symptom reduction, but we're also focused on functional impairment. And we train our coaches, and Nicole, you can relate to this. I'm a nurse by profession, as you are, and all I knew was a nursing care plan. So this is a really good example of psychology and nursing coming together to create a really impactful service. So our staff, our coaches are just, they're paraprofessionals who are highly trained in our protocols. And they're just, I think I have a couple on the line, but they're just so capable of delivering these services, and the therapeutic alliance, as I mentioned, is very strong. Some of the key outcomes that we're seeing, improved academic progress, improved attendance. So we're targeting, not just positive behavior, or sorry, positive parenting to reduce, to increase pro-social behavior and decrease antisocial behavior, but we're also seeing this shift with kids who are coming in who are bullies. By the time they finish our program, they're so pro-social. They've improved their peer relationships. Family functional impairment is improved. Child maltreatment is improved. I just recently looked at a sample of like 400-ish parents who reported spanking their child coming into our parenting program. 90% were no longer spanking their child on the way out. So, reducing child maltreatment risks, suicide prevention, our anxiety, depression, and stress programs that span the entire age span are so life-changing that we've been a suicide prevention solution. Again, our coaches will tailor the program to meet the needs, and I think that's one thing that we really need to focus on, depending on the client that comes in, their background, their cultural background, but also the intensity of the symptoms that are presenting. We really make sure that they're lined up and matched with a coach that can tailor the program to meet their needs.
Yeah, really exciting. I think, we've done meta-analyses in this area as well, and we know that on average, digital health and online programs are effective for improving child and parent mental health. I think research increasingly says that digital programs, as long as they have at least one touch point, so you can't have completely self-directed, I think that's no longer considered best practice. You need to have some sort of in-person or real life human connection to understand, why you're doing this, reorient to your motivation, some of those things. There's lots of work to be done there. But we see really good results with our program as well. Across a number of trials, we've shown, improvements on parent mental health, parent anxiety, depression, anger, sleep problems. Parent anger is one that I think is really important to talk about in terms of the family context. It's not one that is always measured. Anger is so gendered. It's not something that women are often asked about or disclose, but it's something that's really relevant to the family context, to interpersonal dynamics with co-parents and with kids in the household. So seeing a lot of good impacts there, and seeing that when we're asking about parents who are having emotional challenges, they most often come in with a whole bunch. So it's not actually that people say, oh, I have depression, I have anxiety. We ask about 5 symptoms, and I think the average number of symptoms is 3.5 that people are with. So it's really, really common that you see, broad dysregulation when parent mental health is challenged. So seeing really good results there. There's so much work that can be done, and parents are often so motivated to support their kids, and we are seeing improvements in child mental health now as well. but it's hard for parents to take time for themselves. And so I also think that the potential of having accessible programs that parents don't feel stigma about signing up for and that aren't going to take too much of their time is a really also important way to think about the broader mental health impacts for an underserved population.
Yeah, thanks, Leslie. I think the former Surgeon General in the US put out a whole report about how hard it is to parent these days. And it's great to hear that all of your programs are finding ways to support families. So you've spoken to a few different challenges, including funding and interoperability. What are some other challenges or tensions that you've encountered as part of adapting and promoting digital solutions? And while you answer that question, if you could also keep in mind providing advice for those who are hoping to engage in this type of work.
I can start with this one. I think some of the challenges that were highlighted before include figuring out, how you're going to, if you're trying to build something like an app, for example, or a website, think about, what is it that you're trying to build and why. I've had a lot of discussions with folks who work in the, broad digital health space, not just specific to mental health. And some of the initial feedback that I got that has continued to resonate today is the keep it simple, stupid advice. Like if you can deliver a fancy app to deliver what text message could deliver, just do the text messages. If you can deliver your content on a website, which is much easier to build and maintain instead of an app, just do the app. If you can deliver the program on Zoom and you don't need this other stuff, do Zoom. And so because the technology is complicated and expensive and iterative, making sure that you know why you want to do something as opposed to just like, oh, I could do this thing. It's sort of the flavor of the month to try to build an app. You want to really make sure that like this is what you want before you do it. And to also make sure that you're building really strong relationships with folks that you're working with. We are working with a developer Mindsea now out in Halifax. We had previous relationships with tech companies that we ended because we did not have a good relationship. We didn't feel like there was a lot of mutual respect between our expertise and their expertise in voicing challenges, voicing our expertise and knowledge of the population and the content. And so I think making sure that relationship element is there between all members of your team, knowing that that probably stretches now beyond your immediate research lab is really important. And also asking for advice. I think I found the digital health community of academics really supportive and open because there are so many challenges in this space. If you're looking for a rec for a company, reach out to someone. If you're having a challenge, anyone's welcome to reach out to me at any time. I think it's really interesting and I think it's really exciting that there's more people who are interested in working in this space. And we really benefit when we come together as a community to face some of these challenges together.
I can go next. I'm just going to add to that. I agree. Like partnerships, relationships. That's what I say. And it doesn't matter, what sector we're looking at, whether it's a technology partner, it's got to be the right one that meets your needs. We've heard just, as we were talking about the challenges with timeliness, adjusting, doing any kinds of improvements and the cost behind it. So I really highly recommend doing that research on, and especially talking to the folks who have already gone through some of those experiences. Like Leslie said, I'm happy to provide advice of the challenges that we've faced over the years and, how we've overcome those challenges. When you look at funding, and that I think is a really important factor when you're, looking at designing something that's really innovative. What is your funding stream going to look like? We can get funding, like I had mentioned before, for research, but what's the sustainability plan? Government funding, we have been fortunate. We are 75% reliant on government funding, which is great, but it's also an uncertainty right now that we're facing, given the commercial entities that are now currently available, the RFP processes that we're going up against that we've never had to do before, being a sole source organization. And I'm going to just warn us here at the table, it's going to be very difficult for a nonprofit to outbid a deep-pocketed organization. It's happened to me, and it's resulted in, the first time I've ever had to lay off or downsize in a 20-year period. RFPs are arduous. We don't have the internal resources to write them So we had to pay somebody to write them, and we still did not win against a very large organization. So therefore, I'm going to lead to recognizing that you need to diversify your revenue stream. So, we are very much looking at executing a more robust fundraising strategy. We have not been focusing on fundraising as much as we probably should. And so really looking at and grants, we are really focused on the grant calls and trying to make sure that we remain innovative and relevant by, designing new service offerings or extension of our existing services. And again, going back to that relationship building, we have strong relationships with government partners, stewarding those relationships, stewarding your donor relationships. And again, if you have a great tech company that you can count on and they're behind you and your cause and they believe in you, that is really critically important.
I guess I get to round out this one. So just sort of practically challenges and using the digital solution, I think I'll start with that. So the use of the technology by parents, and Leslie said it best. It's got to be as easy as possible. That it can't be no impediments. And so we have tried very hard to make sure that's the case with Zoom. And a big part of that is, so here's the solution part. Not only is it easy, but the facilitators that we train to work with parents, they are able to solve problems. We have somebody on our team who can, oh my God, they can't get access, blah, blah, blah. They can reach out and reconnect the person right away because they have gotten the support they need from the person on our team who's just designated for this, which raises questions about funding, right? You just need to have somebody who's always available to help. And then the use of tech by the facilitators. So we train people to become facilitators, the ones who work with the parents in the Zoom sessions. And that training, as part of that training, they learn how to use the technology themselves. We give them an iPad. They can use the iPad to deliver the program, or they can use their own device. But we give them a lot of training, like a whole half a day is devoted to just using the technology with the parent and all the things that can happen, how to share your screen, and how to, all those things. And the other thing that we do is we collect data by online links, right? So we try to make it as easy as possible for the parents and as easy as possible for the facilitators to support. And then, kind of to your sort of additional points, Trish, around, I think the big challenges for us going forward are sustainability. And even whether or not we were digital, we have an effective program, we want to keep delivering it. And so we trademarked our name. And the University of Calgary helped us with this. They were pushing us to commercialize. So we initially created a for-profit company because that's what they wanted us to do. I don't care about making money. I just want to deliver the program. And I was finding that was just sounded weird. In working with all these community agencies, they don't have a ton of money. They want to think that you're in this for profit, and I'm not. So we also created a not-for-profit arm. So now I have to do taxes twice and blah, blah, blah. And we're not making any money because I keep getting grants. But that can't go on forever. And so now the big push is to figure out how to build capacity for more master trainers, to train more facilitators. And then what's the funding model for this for sustainability? Because I need to be able to support my team to do the training and make sure the program is being delivered with fidelity and all those sorts of things. So these are the bigger issues than just the digital solution, but they're part and parcel of how we will continue to deliver this program over the long term. And I hope I can. I hope I can retire and ride off into the sunset with this program attached.
Me too. I don't know if I have a hope in heck of retiring, but it's, somewhere's on the horizon.
Someday,
Yeah.
someday.
Yeah.
Yeah. But anyway,
But
these
just
are the challenges. Like what's the business? And we're not trained in this. Like, what's the business
this
model?
model. You're just taking the words out of my mouth. What's the business
Yeah.
model? Yeah.
Yeah. So
Thank
gosh. And then
you.
as soon as you
Yep.
talk to not-for-profits about this in the community, they like you're in conflict of interest. It's like, no, I'm just trying to maintain. I'm not in conflict.
These are such rich conversations. I think we're going to go and do a bit of a roundtable, 1 minute per person. But just before that, I want to get to Christina's question. I think we've talked a little bit, Nicole, you addressed a little bit about the digital literacy, and others have as well. But I think privacy and data storage is another really topical question for a lot of folks in this space. Does anyone or does everyone want to speak to, for folks who are not comfortable with their data being stored or have questions about their data storage. Does anyone want to speak to that?
I can hop in a little bit. I'm sure other folks have thoughts as well. I think transparency, accountability, thinking about data ownership is really important. And so having a really good understanding of where your data is when is something that's critical for researchers, critical for sustainability. There's existing best practices for this in terms of how health information is stored and digital safety. So I think going there is important. There's also increasing regulation around digital mental health, software as medical devices in Canada and globally. ORCA, I'm not going to remember what the acronym is for that. It's a regulatory-based group out of the UK. We've worked with very closely to make sure that we're following best practices in app development and data management. They've recently been commissioned by the Mental Health Commission of Canada to develop and contribute to Canada's regulatory standards. Our app-based program is one of the first 10 that's going through these this new approval process. And so I think learning about it is relevant. It's ongoing, but there is information out there and there are good practices. And so I think making sure that you understand what those are, working with your university's information and technology and security team is really helpful. They've been great in giving us advice about what you can and can't do. So there's resources out there, and it's good to have those conversations early.
Absolutely agree. I'll pipe in because Leslie, we also have just received our stamp of approval from ORCA, but also Mental Health Commission of Canada. And I'm actually part of the e-mental health collaborative, so I informed some of that assessment, which is grueling, but it's great to get that badge of honor. So anybody who's interested and or having challenges going through that assessment, we've survived it and we have our seal of approval. One of the things that I wanted to mention, we're going through, so our Strongest Families Iris system is our service system. And our legal team, our privacy lawyer has, really kind of made sure that we're focusing on deletion or de-identifying our data in our iris system. So we have a 2-year cycle where we automatically remove or delete the personal information. That way we still have the raw data, but that was the highest recommendation from them. Now, the key is when we go to apply for a research or submit for research ethics. Research ethics hasn't really come up to, kind of changing the standards of maintaining data. And it'll be interesting to see where this goes because I'm just in the middle of responding to an ethics submission because at the end of the day, we will de-identify the online data. The data is still existing. We can still do analysis on the research project. But if you recall, like from the Tri-Council policy and a lot of the REBs are expecting you to, keep your data for 5 years post-publication. And that's just a huge risk. It's a huge risk for us as a nonprofit to hold and house that personal identification data in our system, in our life system. We know that the increase of hacking has just been exponential in the last couple of years. And we really have to mitigate our risks because we don't want to certainly be victim to one of those attacks. So I think for us, the legal requirements, because yes, we are affiliated with our university here in Halifax, but we still have to pay for our legal counsel through our private privacy lawyer. So it does add up.
I'll just maybe say what's a little bit different from what I've heard. We keep all names and identifying information separate from other data. It's all separate. We follow all the same protocols as everyone else around ethics and everything. And so far, we've been just doing research. As we move it toward evaluation, it'll be a different level of data, and it'll likely be owned by the organizations that we're working with. And it's always a different arrangement every single time. So that's a bit of a challenge. But I thought I would tell you about one thing that might be of interest because we get parents to do videos of them playing with their children, and then we do some video feedback essentially. And we've had really interesting experiences where people of certain ethnicities have said, I don't want to be videotaped, or don't mind being videotaped as long as you can assure me that no male will look at my video, that kind of thing. Or I have to be completely, covered. And, we can't use a video if someone's completely covered. You have to be able to see the facial expressions and so on. So that's been an interesting thing. And of course, we, put all the safeguards under that data. That's our, highest level of security data. And we don't do that kind of work with community organizations because this is more the research side of things. But anyway, I just thought that was kind of interesting that we've had to manage those sorts of situations and just make sure that people's wishes are adhered to.
Thanks, Nicole. Um, Now what we'll do is go do a bit of a roundtable. So if we could have concluding thoughts from each panelist. I can start with Trish, if that's all right.
As I think about all the things that we have talked about, once again, I'm going to go back to this iterative process of co-design. We know our landscape has changed dramatically, even in this last year, with the threat of the tariffs. The possible impacts on our equity deserving populations that already have so much, disparity at this stage. I think it's so critically important for us to be making sure that our solutions are able to be, not just co-designed with the end users, but again, tailored to meet their needs. We absolutely need to get this right by design. So, the investments in these upstream evidence-based solutions that we've just heard all about, I mean, these are essential to the future of our population. Our youth, our future, they're going to be taking care of us. And so we know, I don't know, we didn't mention the article that just came out in October from the Mental Health Research Canada. It's called The Generation at Risk. It's clear that our youth and young people are at risk, mental health decline since COVID. So it's really more important than ever for us to get this right by design so that we're building healthier and more resilient communities, so that we prevent them becoming too entrenched in some of these issues that we're experiencing with housing issues and food insecurities. By providing these digital, really highly effective services, we're going to mitigate that extra psychological toll that these types of issues are taking on our families.
Thanks very much, Trish. We'll go to Leslie and then Nicole.
Yeah, I think biggest piece of takeaway is there's a lot of potential, and we need more people working in this space with curiosity. And so, take it on with eyes open. Don't be too intimidated. I know that there's a lot, and all these panels that can seem like, oh, I don't know how I get from where I am to where I would need to be. But think about those small steps. What can you learn with texting? What can you learn with telehealth? What can you learn with one component online, and build out a structure for where you want to be and continue that co-design work, reach out for support. There's a lot of potential here. And I think my biggest takeaway is, if we as academics and as clinicians with a lot of, ethical responsibility and drive to do this work are not taking up space in digital mental health, tech is. And that's actually pretty scary. And influences are who are motivated and gain profits from making families feel like they're bad parents and that their kids are destined to have mental health problems if they don't buy into their for-profit, maybe evidence-informed program. And so I think we actually have a responsibility to figure this out, even through the challenges.
That's such a good point, really. I think that the potential for impact for us researchers, the potential, if you want to make an impact, you have a much greater chance of making an impact if you go digital, if you go in this way, because you're going to be more accessible. The program will be more accessible. But I think that you have to bear in mind as you go into this that you'll be in it for the long, long, long haul. And if you develop something that works, just as Leslie was saying, we need to compete with those other bodies that are doing things that maybe they don't have an evidence base, maybe have a different kind of motivation, and be prepared to be. It's just, for me, it's just another way of being an advocate for people who have mental health challenges in the community. And we need to be there as researchers promoting the kind of good work that we're doing, and ensuring that it's a good, high quality and for the benefit of everybody. So I think the potential is much greater than some of the other interventions we might develop over our careers that are reliant on in-person connections.
I just want to add one final comment to, I know we've talked about a lot of challenges, and, failure is a great thing. Failure is our opportunity to course correct and get things right. So I see any kind of burp along the way, and believe me, there's been a lot. But when you're in it for the long haul, like Nicole had said, for the better good, tech for good, We can make that difference, and we can just keep this iterative process. You just keep improving and using your data to make it even better and outcomes to show that, right?
I love that. That's a great note to end on. Oh, sorry, was someone going to add something there? Did I hear? No? Okay. Yeah, I wanted to say thank you. That was a great note to end on. I like that. Tech for good, and the importance of failure. I have kids. I teach them about failure all the time. It is really critical, isn't it? So I want to thank our panelists and our participants. We've had the opportunity to benefit from your years of experience and expertise. I think a lot of people are like, apps, an app sounds like a good idea. And so this, I think, is really contextualized like some of the challenges and also opportunities. We've learned about equity perspectives, the challenges around sustainability and funding teams, the importance of co-design, regulatory processes, and I think the really, really important consideration about competition with commercial entities, and how are we going to support our academic and not-for-profit teams that are trying to compete in this environment. So I think really good insights for all of the participants and also hopefully for some of our government and funding bodies to help think through some of these really important challenges as well as opportunities. So with that, I think we can conclude. What I'll encourage, if we do have another minute or about minute here, all of the panelists have spoken to programs that they are operating. If you haven't already, you could put that in the chat for participants. You didn't get to speak to the program in depth, but I'm sure speaking to it a little bit has piqued everyone's interest. So please do put your programs in the chat. I know I personally would love to learn more about what I've heard a little bit about in our panel so far today.